Okay, first structure I need you to find on your patient are the transverse processes of the atlas.
Alright, Ben, I'm going to have you sit right here, face that way for me, feet flat on the ground, arms up. To find the TVP, the transverse processes of the atlas, you said? Correct? Alright, I'm going to find the mastoid process. I'm going to go slide inferiorly to the bottom of the mastoid process, slightly anteriorly. I'm going to flex my elbows, palpate lateral to medial, being aware of the styloid process and feeling for bony resistance. And I feel bony resistance on both sides, so I have located the transverse processes of the atlas.
Okay, next, using a shortcut, palpate the left transverse process of T6. Left
Okay, Ben, I'm going to have you lay
process.
face down on the table for me, please. I'm going to drape you, tuck you, using a shortcut,
Yes.
the left transverse process of T6.
Correct.
Okay, then I'm going to have you, I'm going to take your arms up here, on your back. I'm going to find the inferior borders of the scapula. From there, I'm going to bisect medially to the spinous process of T6. From there, I'm going to go up one spinous process and then out laterally 1 inch. And I'm going to place my external notch over the point of contact, taking out that soft tissue slack, palpate posterior to anterior, feeling for the wag. I feel a wag, so I have located the left transverse process of T6.
Okay, next, locate the right pubic tubercle.
Right pubic tubercle. Alright, then re-drape you here. I'm going to have you flip over onto your back. The right pubic tubercle.
Correct.
Okay, Ben. I'm going to turn around. When I do, I'm going to have you adjust your male anatomy to the right pubic tubercle to your left, and you let me know when you're done with that, all right? All right, so I'm going to have you take one of your hands, place it on your belly button, then I'm going to have you lay your hand flat, feeling for bony resistance. Feel it? Okay. Now I'm going to replace my hand with yours, if that's cool. All right. Then I'm going to slide out towards me laterally 1/2 inch to 3/4, feeling for that bony resistance, and I feel it, so I've located the right pubic tubercle.
Okay, you can take your hand away. Okay, next, palpate the right talus. The right talus.
Okay. So
Right
for
talus.
the right talus, okay. I'm going to cup his foot with my lateral hand. I'm going to find the medial malleolus. Can you repeat the structure for me, please?
The right talus.
The right talus. Okay, I'm going to slide inferiorly from the medial malleolus to the body of the talus. Then I'm going to come laterally and superiorly to the top of the talus, and I'm going to dorsiflex the foot, feeling for the talus entering the mortise joint, which I feel, so I've located the talus.
Okay, your last structure is the left lunate bone.
Left lunate. Okay, Ben, I'm going to have you sit up. You can, the left lunate bone?
Left lunate.
Okay, I'm going to have you sit on the edge of the table facing this way for me, please. Okay, I'm going to take the patient's left hand, making sure I'm not crossing over past his knee there, and also at a 45-degree angle. I'm going to find the styloid processes of the radius and ulna. Come medially to Lister's tubercle of the radius, slide into that joint space. Can you repeat the structure for me again,
Left
please?
lunate.
Okay, left lunate. All right. Now, My medial hand should be on the lunate. I'm going to stabilize the radius and ulna. I'm going to translate the lunate, feeling for movement, and I do feel some movement, and I have located the left lunate.
Okay, you're done.